All right, Beyond listeners, welcome back to the Beyond podcast. I'm your host, Dr. Flora, and I am incredibly excited for our guest today. Dr. Jasmine Sawhne is a board-certified psychiatrist with a thriving private practice serving patients throughout California and New York. Dr. Sawhne offers thoughtful, personalized treatment for depression, anxiety, ADHD, trauma, and the unique identity shifts that come with motherhood. As a mom of two herself, as well as a fierce advocate for compassionate care, Dr. Jasmine Sawhne blends clinical expertise with lived experience to help women feel seen, supported, and empowered. I'm really excited for Dr. Sawhne just because all of us, regardless of gender, regardless of role, are feeling it. And just in our current societal format, it's hard to figure out objectively what is happening. So, Jasmine, thank you so much for coming. I'm really excited to have you here, and I'm excited for our listeners to hopefully gain some perspective and learn something about themselves during the podcast. Hi, everyone. You are listening to Beyond, and I'm your host, Dr. Flora. Listen, life is hard. You don't have to do it alone. As a mindset coach, physician, mom, and an infertility warrior, I have mastered techniques to help move you towards contentment and growth. I can't wait to go along with this crazy-ass life journey with you while making sure you feel like your best self. This podcast is meant to have you feel unstuck from your rut and less alone. Let's do this.
Thank you for having me. This is long overdue. I am so excited. I have been following your podcast for quite some time since you launched.
I appreciate that.
I am thrilled to be here. Hopefully there's some insights that even one or two people can kind of resonate with. And then, what mental health is. Now we've come quite a long way from decades ago, but I think there's still a lot of work to be done. And if we're not having the conversations, we're never going to get there.
Absolutely. And so beautifully said. Well, let's just start with simple definitions because especially over social media, we hear a lot of these buzzwords. So can you differentiate for us stress versus burnout versus major depressive disorder, which is a clinical diagnosis?
Yeah. So I think we throw around these words, stress, burnout, depression, so casually. Sometimes it's like hard to tell the difference, even for ourselves, but they're not the same thing, right? So stress, normal part of life. Body's response to pressure. So there's a deadline, a tough patient interaction, juggling a crying baby in a Zoom meeting. It can be motivating in the short term, but then when it's constant and we're not getting those periods of rest and recovery, that's when it starts to wear us down. Then when chronic stress goes unchecked, we define that as burnout. So this is beyond I'm tired. Now where it's more like I'm starting to lose my sense of purpose. And I see this a lot with healthcare workers, with parents, with high achieving professionals. That you're just feeling emotionally depleted. You're detached. You're just going through those motions. And I'm going to say this, you might still be functioning. You're making dinner. You're doing what you have to do for work, but you're not really there. Like it's a deep kind of exhaustion that rest alone is now not able to fix. So that's burnout. And then there's depression. So now we're going deeper past burnout. And with depression, we're not just talking about like, oh, I'm overworked or I'm tired. This is a real shift in brain chemistry and functioning. So when we talk about depression is a disorder, disorder itself is defined as now these symptoms are interfering with your day to day. That's when we really need to take a closer look at what's going on. So this is affecting how you think, how you feel, even how your body is moving, even the way your body is getting sleep, appetite, energy, concentration. I mean, all of this is a whole total picture when it comes to depression. So there's heaviness. There's a loss of interest in things you used to enjoy, maybe even hopelessness. Like what is my life, and what is there for me to move forward for. This is not weakness, and it's not something you can just snap out of it. You know how people say, oh, you're not depressed, you just snap out of it. No, this requires attention and treatment. And so what I always tell patients, and what I try to remember for myself, is your body is always sending you signals. Stress is a whisper. Burnout, now we're raising our voice a little bit. Depression is your body is screaming for help, 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 help. So where do we want to intervene? We want to intervene where there's whispers, where those early triggers are forming. You don't wanna get to that point when there's so many ways to intervene earlier. So the earlier we listen to our body and those signals, the better chance we have to getting back to ourselves.
I love that. So whisper, increased volume versus just straight up screaming,
Gleaming.
yelling. Yes, that I love that. So I think these take home messages are so important because stress is reversible. That's kind of how I also say, like, if we can use a metaphor, because I love metaphors, stress is, like you mentioned, it's something that's reversible, something that's temporary, maybe a nap, a vacation, some time away, taking a break, watching a movie can hopefully help reverse that. And maybe something that needs to be slightly more prolonged if the stress has been ongoing for quite some time. And so if we equivalent it to like a car, it's more like, okay, I need to re-energize I have an electric car, that's why I say energy, but I need to charge my car or fill up gas in the tank versus
Refuel,
burnout
yeah.
is like your car is stuck on the side of the road, gas tank empty, engine is gone. You got to take it to the mechanic. The mechanic then works on it for a week and then brings you in and teaches you how to maintain your car. And then depression is a whole other ball game. Like the internal workings of the car is incorrect and it needs to be, again, treated, maintained. But also chronic burnout and major depression can go hand in hand, or one can lead to the other, right?
Yeah. Yeah. I mean, untreated stress and
Mm-hmm.
burnout will ultimately always lead to some sort of symptoms that are consistent with depression. You may not hit 5 out of 9 for the full diagnosis, but even if you're hitting 3 or 4, that's significant enough to require attention. And I love the analogy that you just created with the car, because that's exactly right. Or are we doing a little recharge, refuel? Are we going in for a maintenance, or are we trying to repair parts now?
Hmm. And also, just to take definitions one step further, high functioning depression, I know it's not a clinical diagnosis, it's something that I talk to my own patients about, but a lot of times people will say, well, I'm killing it at work. And I'm coming home, I'm taking care of the kids, I'm making plans, achieving my to do list, running the household, but I'm still not feeling like myself. Can
Mm-hmm.
you describe what high functioning depression looks like?
Yes. So you're right. It's not an official diagnosis, but I use that term quite often in my practice as well. And it's used to describe people. Yeah, you're meeting all the demands of daily life. You're showing up for work. You're raising the kids. You're feeling like you're getting through everything, but when you take a closer look inside, what are you feeling? Are you feeling heavy, exhausted? Are you numb at this point? Like, are
Oh,
you just
that's a good
really
one.
going through the motions and you're numb to what is actually happening in the environment around you? Like, you're doing everything right on the outside. And it's a quieter form of depression. Like, there may not be those stereotypical days in bed, like, oh, I can't get out of bed. That's not happening. And there may not be the crying spells, but there's just this deep sense of disconnection. Like, the joy is just not as joyful. The rest is not as restorative. You're irritable, you're overwhelmed, like you're constantly on, but then you're not really present, right? Like, there's just this
Yes.
interesting paradox. Like, I'm there, I'm there, I'm there. You're showing up, but then are you actually enjoying and being present for what you're showing up for? And so women in general, like high achieving, caregiving, culturally driven, like women, it can look like she's performing well at work, and then that imposter syndrome is creeping in every day. She's taking care of everyone else, but then no one's really seeing her. She's
Yeah.
laughing at brunch. She's leading the meeting. She's packing the
Huh?
lunch boxes. Then she's laying there at night like, I'm just empty. I'm anxious.
Yeah.
Why am I not happier? And then
Yeah.
there's shame. There's shame because, when you look at this woman or this person from the outside, her life looks fine. It looks great even, and then she minimizes it because she tells herself, oh, I'm just tired. Or you start comparing yourself to someone who has it harder than you, who has it worse off than you. But is pain a competition? Because if something
Yes,
doesn't feel
thank
right with
you.
you,
We need to shout that from the rooftops because even with my infertility journey experience, I remember not allowing myself to feel sad with losses or unsuccessful transfers because then I would look at someone else and say to myself, well, they have primary infertility, like they can't
right?
have any children yet. And I
So
have
I
been
should be
blessed.
grateful. Yes, I should be
Exactly,
so grateful.
exactly. But it's more
But that
nuanced
takes
than that, right? You can do both. You can
yes,
feel both.
and so what? You can have your own experience and you've shared so graciously with your audience about what secondary infertility really is. And if that doesn't feel right for you, it deserves attention, right? Just because it's not primary or because you are grateful to have your daughter, but you can still mourn the loss and identity of what you wanted, what you
Yes.
envisioned for yourself. And it's okay to be grateful and mourn something else. It's okay for two things to be occurring at the same time. And so for really atypical high functioning depression, I think people they try to talk themselves down and out of
Yes.
it.
Yes,
And I don't know
absolutely.
if that's
And
the
these are
right.
smart, intelligent, forward-thinking women. Like I don't think we can put any of this in a box. Like there is no identity to a
Mm-hmm,
lot of these syndromes and diagnoses. And speaking from personal experience, like I have felt all the symptoms at one point in time that you
mm-hmm,
just described. So sometimes I believe I think it's hard to really understand the depth of what dread feels like when
mm,
everything around you, you're like, I have the house, I have the job, I have the podcast and the business and the kid.
mm.
I have everything, but I'm waking up with zero emotion, like that
Yeah,
numbness.
the
And it's
numbness.
crazy feeling like that. That being said, it doesn't always stem from burnout or chronic stress. It could be situational, it could be triggered by a circumstance, a stressor in life. So I think it's still important to keep those signs and symptoms, although it may be normal, like grief, for example.
Of
You
course.
can go through a lot of those emotions. So what is the timeline? Say it is situational or triggered by something. When should someone say, okay, this is not a normal reaction anymore? I need to go seek help or talk to someone.
Well, so I will say if there's like an acute stressor, right? We want to give
Mm-hmm.
ourselves grace. We want to give ourselves a couple of weeks, 4 weeks, right? A month. You want to really be like, am I responding to a very immediate crisis? And that is what my body is signaling to me. And at what point has that shifted, right? So now we're past this like acute time frame and the weeks are adding up. The months are
Yeah.
adding up. I mean, it's been 3 months now. Like even after delivery, right? Like we say there's the
Yes.
fourth trimester. We give ourselves a little bit of grace around that. So for any sort of just clinical presentation, we want to think about time frame. And as the weeks and the months are piling up, and again what I said about like your day-to-day functioning now getting impacted, so now it's not just okay, I'm grieving or I'm responding to a high crisis or a stressor. Now it's been 4 or 5 months past this like trauma or incident, and I'm still not sleeping well. I'm
Mm-hmm.
still not concentrating at my peak performance. My appetite, like I had lost like those initial few pounds because I didn't have an appetite, but actually now that I think about it, didn't really come back. I didn't really get back to baseline. My energy is still low. Like I'm going to the gym, but on the other hand, what normally brought me a boost of energy isn't quite
Yes.
cutting it the same way. So it's kind of like these like small little nuances, right? Like
Yeah.
you know that something's not sitting right with your body, um, and maybe like others around you can pick up on it like here and there, but they're so subtle, and then they build, right? And then what we talked about, like the big cry for help happens, right? So whether it's like sleep used to revitalize you. Now, like you've gotten like good quality sleep and you're still feeling exhausted. You feel like you're faking it at work. You're faking it with your kids, even faking it with friends. Like you're
Yeah.
snapping more. You're feeling just
Hmm.
flat. So
Yeah.
that time period often grows, and it's subtle, like insidious, and it's in its own way. Like it's just creeping up slowly and slowly and slowly. But then you look back and you're like, it's actually been now like 6 months.
Yeah.
So
So I think it's
how did we get there?
important, right? And it's also important, and you brought this up, to compare when you are self-reflecting. It's hard to be objective, but in a way to compare yourself to your baseline. Like a lot
Yes.
of us, don't swing to these extreme emotions, right? Maybe most of us are neutral. Maybe we do live in our mid ground. Like we feel joy and then we're back. We feel upset, then we're back. Like we're able to regulate our emotions, but are we now sticking to one
Mm-hmm.
extreme versus the
Mm.
other compared to our baseline? So I think that's important to keep in mind, because we're all human and we all feel differently and react differently day to day. So I think it's important for anyone listening out there to, one, take the time to actually self-reflect and figure out, like, do a check-in with yourself, because sometimes we're just on the go for so long that by the time we actually get to a point where signs of chronic burnout is popping up, our bodies start to physically tell us. And then you go to the doctor and you're like, hey, I'm having gut issues, or I'm not sleeping
Mm.
well, or, I'm feeling nauseous, or whatever the symptoms may be. At that point in time, it may be too late. It's hard to say. So do a check in and compare yourself now to your normal baseline. So let's shift a little bit, still within mental health. Let's talk about anxiety. That's another thing that seems to be so widespread, talked about. Is this the new norm, that we're all just living in this high state of anxiety, or are we just finally diagnosing it more because we're actually self-reflecting more?
So, double-edged sword. I think on one
Hmm.
hand, yes, anxiety is more common than ever. So we're living in a time of constant input. We're getting news alerts. It's social media. There's the pressure to be productive, perfect, present. Like we just on, all at once. And it's not even just compartmentalized. It's all at once. And for women especially, there's that invisible checklist that we need to be crushing every day. Be the present mom, be the accomplished professional, be the supportive partner, get your steps in. Like it's all of it all at once. And our nervous system, it's getting overwhelmed. But on the other hand, I don't think that anxiety is new. What's new is we're finally talking about it. And so when you give language to what so many people, especially like high functioning, high achieving people, they've silently carried for years. We used to call that like type A. And I used to use that term myself. Like you ask me in undergrad and medical school, I'm like, oh, I'm so type A. I'm like wired that way. But
Yes,
no,
was
that's a
anxiety.
no, and we
Yeah.
have a term for it, and the term is anxiety. And we don't just have to live with it. And again, it's sneaking up in those ways like perfectionism, people pleasing, what you talked about, physical symptoms, headaches, chronic headaches, like, oh, I'm going to go get evaluated for migraines or gut issues. Like you look completely put together on the outside, but then inside your body is starting to tell you, no, 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 something's going
Hmm.
wrong. And so when you ask, like, is it the new normal? Like, yes, we're living in a very anxious world, but the bigger shift is we're naming it. And so we're talking about it. That's the good thing. When you name something, you can treat it. Stop blaming yourself for not handling things better and look at what the anxiety is trying to tell you.
That's such a good way to put it. So let's talk to the woman out there that is listening to this and she is responding in her head like, okay, all of that sounds good, yet I have, multiple kids. I have a full-time career. I also am the primary breadwinner. I run the household. I have a partner who works the same amount of hours. We're juggling, so aging parents. That's another thing. We're in this
Oh,
sandwich
yes.
generation now. I'm juggling so many roles, and yeah, I'm doing all the things, and I think I'm doing okay. And sometimes I feel low, sometimes I don't. I'm going through all the normal human emotions, but I'm also feeling mentally drained. Where can I start amid all of the other things that I'm also juggling?
Right. So what I always like to practice micro recovery methods because my schedule is the same, right? Like I'm planned out to the minute, right? So micro sort of techniques. I like this with moms. I like this with professionals. Just tiny ways to refuel throughout the day. What does that look like? A minute of deep breathing in the car before you're going into daycare to pick up the kids. Stepping outside for some. I mean, you're great about that. Stepping outside for sunlight, 5-10 minutes
That's
in between patients.
that
I
is my
love that you
treatment.
do that.
That is my
Yes.
actual treatment.
And that honestly is a micro recovery technique. Listening to like a voice that you enjoy, maybe like a podcast while you're folding laundry. I mean, these small things matter. And then the other is compassion. And I'm not saying like
Yeah.
show compassion to others. It's the kindest thing you can actually do is like, of course I feel this way. I'm carrying a lot. Just saying that
Yes.
to yourself.
Acknowledging it.
Yeah, like, of course I feel this way because
Yeah.
I am carrying 7 different plates all at once. And I feel like I am doing this struggle. So stress softens when you stop being so hard on yourself. And I always tell my patients, like, the biggest red flag to me is when you say, oh, I should be handling this. No, you shouldn't. Why? Why should you be? Your body is telling you something is up. So why do you feel like you need to override that and tell yourself, I should be handling this?
Yeah.
Getting out of your head and into the world, talking to someone, whether that's a friend, whether that's a therapist, whether that's your partner. I mean, you know who you can be yourself and authentic with, or even just writing it down. I mean, like, again, when you name the stress, you're containing it because
Yes.
now you've given language and words to it.
Yeah.
Movement is another one that I am like a huge fan of. So I'm not saying now you need to carve out a 45-minute workout and you need to hit your 10K like
Yes.
that. That's burden. That's obligation. Dancing in your kitchen. Dancing in your
Yeah.
kitchen when you're making dinner. You have to make dinner. Might as well make it fun for yourself. Move your body while you're doing it. Stretching before bed. Like, everyone's like, oh, okay, like I have to do like my whole skincare routine. Like I have a 10-step skincare routine. But what about stretching before bed?
Correct. I use
All of
this
it.
with my patients all the time. Like, what is your bedtime and morning routine when it comes to your skin products? And why don't you cut that down by 2 minutes? 2 minutes out of the 10 and stretch, do some yoga
Yeah.
poses. I mean, simple. I love that you mentioned micro because a lot of our society, social media included, is at a macro level, right? We got the before
Hmm.
after pictures. We
Oh,
got,
yeah.
I'm going to now organize my refrigerator with these beautiful clear bins, which I've definitely fallen prey to because I have them in my fridge. That being said, but you see the before after, you don't see the interim. You don't see, okay, this human being wants to reorganize her fridge and make it look pretty amid probably balancing a career and children and running a household. That this whole reel, 5-second reel, took her a month to
Yeah.
film and make. Right. I think we
Yeah.
we think
Yeah.
on such a big macro level that we need to, it's like an all or nothing mindset, when in reality it just takes building and habit stacking and starting small. I say, like, stupidly small. If you think you cannot go outside and walk, maybe start with 1 day a week. Is
Hmm.
that doable? I always ask. I would reflect it back on my patients or on my clients. Like, is 1 day a week for 15 minutes doable? And they're like, yeah, but what difference is that going to make? I'm like, more than the nothing,
Right. That's
more
true.
than the zero
Exactly.
minutes. And then you plan and you build. And so I think this is more when we talk about micro habits, and micro breaks throughout the day. It is a buildable thing. It's a buildable habit.
Well, once your brain gets wired to do something consistently enough, now it doesn't feel like you have to do it. Now
Yeah,
your
it takes
brain
less
is like,
energy.
Yeah, your brain is like, I need it. I need this. You've put this into my system. You've integrated these micro sort of breaks for me. Now that's how my body is going to allow it to recuperate. So tiny is powerful. And again, you don't need to wake up at 5 a.m. and meditate for 30 minutes. I mean, just put your hands on your chest when you wake up. Breathe. 60 seconds of breathing. I mean, it
Yes.
sounds small, but you're just checking in with yourself like, the day is starting. Take a pause. Send your nervous system a message. I'm allowed to take up space today. I'm
Yeah.
getting started and I am allowed to take up space today. And
Yeah.
it'll
I love
build.
that.
It'll build.
And also, one thing that I tell almost everybody, put your damn phone down in the morning. Don't go to your phone. I bought a separate alarm clock because
Old
I
school,
was,
yeah.
yes, I was falling into this scrolling habit where I'd
Oh,
wake
yes.
up, check my mail, check my text messages, check the news, check every social media. What messages did I get? How many likes? I mean, that is just scientifically, you're going from a relaxation brainwave as you're coming out of sleep, and then you're slamming it and
High
stressing it
energy,
out.
yeah.
And
Oh,
that's what
man.
that's the tone that you're setting for the remainder of the day. So of course you're going to be stressed out the minute you get up and start brushing your teeth. You just you just flooded your brain with a
Yes.
bunch of stuff. It's like, you're coming home, you're tired from work, you had given a piece of yourself, right? To every one of your patients or colleagues or whatever genre you work with. And then your kid's like, mom, mom,
I
I
need a
need this.
snack. I need a
I
snack.
need,
I need
yep,
a snack.
yep. That's what you're doing to your brain. Like your brain is already, coming out of its like Zen zone. And then you're like, hey, administer all of this stuff and acknowledge all this stuff and process all
Yes.
this stuff. And then
I'm like,
also go about your day.
add all this to your to-do list, as if your
Yeah.
to-do list that you created last night before going to bed wasn't long enough. Now you have a whole bunch of messages telling you missed
Yeah.
this, you forgot to do this, you need to add this, and you've amplified the stress that you carried forward from the previous day.
Correct. And so I guess that leads me to my next question. So we're all stressed. Okay. We're building micro habits and life throws us a curveball as it normally does. Let's go over the worst ways to deal with stress and then best ways. How can we shift that over to a better way to cope?
Sure. So worst ways, and I've done most of these, so we've all
Yeah.
been there.
We're all
But
human.
we do have to understand that these are the things that are not nourishing us. So doom scrolling. Okay, I used to put the kids to bed, collapse on my couch, and doom scroll for 2 hours. Like I was just like, oh, I am just decompressing. But really not. I'm not relaxing when I'm doing that. I'm avoiding and I am trying to create this bubble for myself, and the information, the like input that I'm receiving from what I'm doing is actually more harmful than beneficial for me, right? And then the other thing is overworking, right? So we're just staying busy. So we don't actually have to feel what's going on with ourselves, right? We're overworked. We got to get to the next thing. There's this practice, and we get home for this, and we do this, we do that, and then that's it, right? Like then it's time for bed and to start all over the next day. So you're not actually feeling what's going on, and then this one I think is the biggest red flag is shutting down. So now you're like emotionally checking out from the people that care about you. The people are trying to engage with you, and you have reached that point of burnout and maybe tipping point of depression where you don't want to socialize, you don't want to engage, you
Yeah.
don't, or whatever it might have been for you, you just don't want to do those things. And those are the worst things to keep compounding on. Some things can give you short-term relief and it may feel good in the moment, but when you think about long-term consequences, like even when you try to turn to like alcohol or binge eating,
Mm-hmm.
right? Like those long-term consequences are not things that people are thinking about. You're like, oh, I'm just gonna have like one glass of wine to unwind. And it goes to like, oh, well, I had a really tough day, so let's just open a bottle, right? And then it keeps going from there and there, and then now it's become an unhealthy coping mechanism for stress. So I would say those are some common worse ways, but there are obviously healthy ways, and the healthy ways are not these like flashy things, and they're probably not going viral on TikTok.
Yeah.
But they're They're probably not, because they're not this like attention grabbing mechanism, but they're still powerful. And what you can do to bring you back to yourself are the healthiest things that you should compound on. And we talked about like those micro techniques. We talked about movement. I personally think that
Mm-hmm.
everyone should have a therapist, an outlet.
Correct.
I
100%.
mean, you don't need to be in crisis to talk to someone, and
Yeah.
especially talk to someone that is not associated with any other domain
Someone
of
who's
your life.
objective. Yes.
My friends used to be like I was in my own treatment for a long time when I was in training, because now it's like I'm sitting with other people's problems, and it can have a sort of effect on you as well. And my friends used to say to me, why do you need to go see someone? I mean, you're learning how to do this. You should be the expert. And I was like, for me to have space to talk about what is affecting me in whatever
Yes.
realm that is, that's critical. And it's different than talking to you as a friend. I mean, we have a different relationship. You know me in a very different way. It's different from talking to a supervisor, because a supervisor knows you in a very specific way. But the relationship you build, and I mean, like, if you really are engaging in therapy, long standing, the alliance that you build with your therapist will serve you well through so many life transitions. You don't want to be going into a therapist to put out a fire. Like, hey, I'm going through a divorce. Let me catch you up on my entire romantic history from my very first partner, how I have like what my attachment patterns are, how the like marriage came to be, and now what's falling apart for this divorce. You'd rather have been with a therapist through the good and the bad. So when there is something coming to the surface, you guys can strategize instead of playing catch up.
Yeah, and I love that you brought up the fact that everyone needs to be in therapy. I agree. I'm a primary care physician. Preventative care is my love language. I've said this so many times before. Start before you get hit. So if you are able to build these micro habits, coping strategies that work for you, whether it's through therapy or if you don't want to do therapy, there are coaches. That's what I do. There are outlets and there are experts out there that can help you when it's good. So when shit hits the fan, you're
Yep.
able to throw all of your strategies that you know have worked before and you're ready to go versus, trying to climb out of it when you're already really deep. That's
Deep.
really tough.
Yeah. So, I mean,
Talking,
yeah,
go ahead.
therapy really isn't about fixing something.
Mm,
When you really think about what a therapeutic relationship is with somebody else, it's to know yourself better and to grow. It's not the quick fix. I mean, that's really not what therapy serves its purpose for. It is to allow yourself to identify certain patterns that you chronically repeat, and to formulate ways to like pick up on those patterns, and maybe introduce new habits or ways of being, so that you don't end up in cyclical patterns. So
yeah.
you understand yourself better, and you grow from there. I mean, the trajectory should improve, not like I'm in a crisis, put out the fire, now I'm going to drop therapy, start back where I was, and then there's going to be another stressor in my life.
Yeah.
Like, you don't you want
It's a
you want a
cycle.
linear improvement.
Yes, that's a great, great call out. It's tough when you're feeling badly to have patience, but that is what we are telling you to do as someone who wants, I'm the most impatient person in the world. I want things done yesterday. So when I was feeling unwell, I was like, I just want a medicine or medication. I just want someone to just snap me out of it. And of course, I practiced this, and I still, my brain was telling me something very, very different. So it was nice to have an objective voice come in and slowly help me. And of course, medication from a chemical standpoint also aided in that. But I'm still in therapy, and it still helps to talk about my good days and my bad days
Yeah.
because there's acknowledgement there. A lot of the times as high functioning, high achieving women, we don't acknowledge our achievements. And
Your
then
wins. Yeah.
we just continue to build on the next goal. So speaking of therapists, I find a lot of people having trouble, one, finding a therapist. Not only, I mean, let's talk about the healthcare system, and that's already broken, but I'm not even referring to that. I'm just saying they find it difficult to connect. So when you start therapy, what are maybe some things a patient should look for that they're like, okay, let's just stick with it. Nothing groundbreaking happened in this one session, but let me continue sticking with this person versus, oh, red flag, I need to definitely go to a different provider.
It's such a personalized approach. So, what I will say is really be in tune with how that person makes you feel. They are on the receiving end of a lot of vulnerable information. If the person sitting across from you does not make you feel welcomed for sharing, if they don't seem compassionate for your like stressors or grief, and if they're trying to overtalk you and just tell you what you need to be doing without hearing you, I would say those are a couple of automatic red flags. You can also be a little bit introspective about, do you have preferences for male,
Mm-hmm.
female? You know, are there certain things, and we all have this, we've carried certain experiences with us throughout our life where you have this unconscious sort of inclination to someone. Like,
Mm-hmm.
I relate better to someone because I know they're a woman. I actually had a very traumatic experience with a mother figure growing up, and I don't want to like kind of share and be exposed and vulnerable with a woman. I prefer to talk to a man. Do I want to do therapy virtually? You know, is this something that I'm committing to, but it's going to create an additional obligation if I have to go into someone's office? Like, do I need to sit in traffic for 30 minutes in order to
Oh,
have a
yes.
1 hour appointment? But on the other hand, there's some people that are like, I'm going into the office. This is my sacred time with someone. If I'm at home, I know I'm going to be distracted by something else. So for
Good call.
me, it works. I need to be there physically and so that I am 100% mentally present. So you really need to do a little bit of introspective work to kind of see what preferences you have. And then as you were speaking to like the first session being very anticlimactic, like I mean, for therapy in general, I don't think you should be expecting
Yes.
groundbreaking results day one. It's what we talked about. It's those like subtle improvements that compound over themselves for weeks and months. That's what we're really thinking about in terms of like linear progression. But you had like a very blah session. Like they seemed okay. Give yourself 3 sessions. And it's almost like dating, right? Like it's like,
Yeah.
okay, the first one was like, okay, will I see them again? Like, I'm not like rushing to schedule a second date, but then on the other hand, there was no like red flags about them. So you'll test the waters again. If by the third interaction you feel like your needs are not being met or your concerns are not being validated or heard, find another therapist
Yeah. Yeah.
and
Those are
have that conversation.
wonderful tips.
Have that conversation with your therapist. Like, hey, I still want to be engaging in therapy. I don't know if we're the right fit. Would you happen to have recommendations for someone that I'm looking for that's more in line with this? Therapists have a broad network, and so they can navigate for you. Like, you've already gotten now your foot in the door. Don't give up. Don't be like, oh, I need to start over from scratch. I need to go back to the drawing board and like try to find someone. Ask them. Be like,
You
hey,
have the
I know.
resource right there. Yes.
Yeah.
Yes. Can you repeat that statement? I feel like everyone needs to, because it's nerve-wracking standing up to yourself in a medical setting. I feel like people are nervous to seek second
Advocate for
opinions.
yourself.
Yes. And especially to the person that you're not quite matching up with. Let's repeat that statement so people can write it down and then use it if they're not clicking with their therapist.
Yes. So if you feel like you're really not jiving with the therapist, I encourage you to just say, hey, something between us is not working well, but I am still looking forward to being engaged in therapy. Are you able to provide me with a couple of names that I can kind of turn to, so I can see if there's just a better fit for me out there? Because I am not going to not prioritize myself. But I want to be able to be getting 100% of what I'm looking for. And I will tell you, there's not going to be one therapist out there that's going to not have a referral network.
Yeah, that's such a good point. I don't think I've ever thought about that. And I also usually say, even if you may not click, your gut reaction to the first 3 sessions may not be great, some therapy is still better than nothing. So while you are searching for your second
Hmm.
therapist, continue therapy. It is okay, even if it's helping a little bit, and even if you're not 100%, jiving with your therapist, it's okay to continue while searching. I think that's an okay
Yeah,
thing to do.
just like dating, right? Like
Yeah,
you
that's
could
true.
date, until you find the one.
That's true.
So you could browse therapists until you find the one that just gets you.
Yeah, that's a good point. Now, I do want to bring this very specific topic up because one, it was a common theme among a lot of my followers on social media. It's something that I do, it's something that a lot of my clients do. And I've learned ways to help myself do it, but I want to hear from you about rumination and what rumination is and what we all ruminate to a certain extent. What can we do to minimize it or use it to our advantage?
Right. So, I mean, rumination is something even I myself will do. I mean, everyone is doing this, and it's really just sitting in cyclical thoughts that are on repeat, like the same thought looping. It's like a mental hamster wheel. You're
Yeah.
replaying the conversation. You're second guessing your choices. You're future tripping about something that hasn't even happened yet. I mean, it feels like you're problem solving, but it's not, because you're just spinning. You're just spinning in circles. It feels very tricky because it feels productive, right? Like you feel like
Yes.
you're processing. Oh, I'm just replaying this conversation because I want to like kind of analyze it, and so that I can better myself for the next one. Like you feel like you're processing, but most of the time it's just draining your energy, and
Correct.
you're stuck in that anxiety loop. And I want to just go back to this like tool that I recommend, and I use it myself. It's like you name it, you notice it. You just say to yourself, I'm ruminating right now. That in itself creates some distance from it. Like you're not your thoughts, you're just the person observing your thoughts. So, once you create that distance from the rumination, that cycle can start to break. And the other really like simple trick is pattern interruption. So stand up, shake out your like hands, wiggle something, like splash cold water on your face, do something like count backwards from 100. Like now you're telling your brain, like, I'm going to change the channel on this, because
Yes.
the cycle is so prominent in my brain. I have to either physically move my body to stop the thought that's repeating, or I need to do something else in terms of a mental exercise to be able to break that loop. So the more you can catch the loops and gently interrupt them, then the more space you're creating for clarity, for peace, for being present, right?
Yeah.
Because sometimes you'll even be amongst others and you're ruminating about something that you said from like a previous conversation. Like,
Yes. I
you're
find
at a
myself doing that so much.
yeah, you're at a networking event and you just talked to
Yes.
someone great. You talked to someone great. You said all these things that you're
Uh,
talking to the next person that you're trying to meet, but your mind is just like, wait, why did I say that? And
are
then you're
you
like,
in my brain right now? This is exactly what I do. Wow.
So I would catch myself doing that, and I would be like, let me go to the bathroom really quick,
Yeah.
reset, regroup myself, forget what happened with the last interaction. I'm here. I'm at this great networking event. I'm excited to meet the next 10 people. Quick water on the face. You've interrupted the loop, and we're moving on.
Yeah. So name it and notice it and pattern interruption. I think those two things are great ways. I know what my therapist told me alongside those two very, very useful tools is ruminate with a purpose. So if you're going to think about something and you've tried all the things, you can't get it out of your head. And there are just certain topics that some people are triggered by more so than others.
Mhm.
And if you're going to continue thinking about it, write it out or figure out why you're ruminating. Are you ruminating to figure out a solution? If so, that is your purpose, and move towards that
Mhm.
direction instead of this hamster wheel that you had described. Or are you going to ruminate because you actually do want to find a deeper meaning behind what this person said or behind how you reacted? Or are you trying to decide upon what direction to go with a relationship or with a conversation, your next steps? Ruminate with a plan, with a purpose.
Mm.
If it's still bothering you, because again, there's something in your subconscious that's probably telling you, like, okay, yes, I interrupted the pattern. Okay, yes, I named it. I recognize I'm ruminating, but it still continues to come back.
Come picking at it. Yeah.
So figure out a plan with the rumination, after you've acknowledged it and after you
Love
tried
that.
pattern
I
interruption.
love that with a purpose. Yes. And I would go as far to be like, if you know that this is something that is continuing to kind of chip away at you, carve out some dedicated time to address it so that it's not just it's happening to you. Now you're being mindful and choosing a period of time where you are going to spend the time thinking about that thing, because now you have changed the narrative around how those thoughts are going to present. They're not occurring to you. You are now addressing them. And that is just a powerful tool in itself.
Yes.
I'm giving my time and energy and bandwidth to this thought. I've allowed myself to do this now.
I love that. I love that. Yeah, having a set aside time. I like pen to paper, so I tend to write things out. Like it looks like scribbles to anybody else. It doesn't have to be legible. And then there's like a symbolic thing that I do is I rip the paper once I found the purpose or the end result of why I wanted to think about this and spend time thinking about it. I rip it into shreds, throw it away, and it's like a symbolic way of telling my brain, you are done.
Yep.
You have spent 15, 20, 30 minutes thinking about this, figuring out the next step. Now move on from that next step, because this hamster wheel that you were on, you weren't going anywhere. And now
Yeah.
you've made a tiny step forward. So that thought is gone. Now this is the thought on hand, and then move forward and use your tools and
Yep.
techniques.
I love it. I love it.
I'm glad we got a chance to talk about that, because I know rumination is something that's so prevalent, and we're human. We all do it. We all replay
We do.
conversations and,
Of
yeah, think
course.
about things. So if we can take control and have tools and techniques to actually approach it, we could at least ruminate with a purpose and get somewhere with it. Do you ever feel like you are juggling a million things at once? Especially if you are a business owner. You're trying to grow your business, but also, run your business. It can feel like you are drowning in your to-dos with barely a moment to breathe, let alone dream bigger. I have been there. Now, look, I tried hiring a gamut of virtual assistants, but it often felt like there was just one other thing on my to-do list. I had to spoon feed tasks, constantly check in, recheck their work, and still worry about things slipping through the cracks. It wasn't until I found Savannah and Natalie at Every Virtual Solutions that I truly understood the difference between help and the right kind of help. They have extensive marketing, development, and executive assistant backgrounds, so they can take the weight off of your shoulders so you can focus on what you do best, being the visionary. Book a free discovery call on their website and mention this episode for a 10% discount for your first 6 months. Head over to everyvirtualsolutions.com. That's EVERAE virtualsolutions.com. Whether it's web design, content creation, email management, social media, PR, or anything in between, I know you will find a way to work together to lighten your load. It's time to end the burnout and start focusing on you. Okay, so I'm going to move to my rapid fire questions. I love this because it just
Ooh.
kind of gives you like a gut answer. 1 to 2 word answers. Most of the time, I want you guys to expand on your points because I'm curious, but we will try to keep it short and sweet. All right, first question. You ready? What is one belief about motherhood you wish every mother would unlearn?
You don't need to lose yourself to love your family.
Yeah, you can be your own person and a mom and live
Yeah.
all the labels. I love that. I think I know the answer to this after our conversation. What is the most underrated mental health tool we all have access to?
Self-compassion. Treating yourself with
Yeah.
kindness that you would show a friend.
Yeah. Oh, yeah. I like that. What is the biggest mental health red flag that gets often brushed off as, quote, just stress?
Chronic exhaustion that sleep is not fixing. So when you're just drained all the time, yeah, it's not that stress. We're talking about your body is signaling burnout, maybe depression.
Yeah, burnout is not a badge. That's another thing that I feel like
Hmm.
a lot of us, especially our generation, we grew up working and working more and working hard and working harder. And by the time we do burnout, we almost feel like it's it's an accomplishment because we worked
Right.
ourselves to the bone and then it
And a
takes
lot of that also comes from like being from immigrant families where they
yeah.
had no choice but to
Yes.
work that hard. But
Yes.
they did so that we have a better way of adapting, right? And that's
Yes.
that's that's evolution at this point. So we don't need to carry the same sort of burden as previous. I mean, we've come a long way, like I was mentioning, but we have to keep doing the work.
Yeah, I like that. And I think a lot of times, especially as kids of immigrants, we find that we're holding on to a lot of resentment against our parents who didn't have
Yeah,
the emotional tools and techniques. They were just concentrating on keeping a roof above
surviving.
our heads. Yeah.
Yeah,
And
just
so very
surviving.
different. We're in a privileged space because of our parents. We have the emotional space because of the sacrifices that our parents made. So having a little bit of compassion towards what they went through in their experiences. And also, nobody's perfect. What is your, Dr. Sawhne, what is your go to grounding technique when your nervous system is just fried? You got 2 kids, you got a thriving practice, you're making podcast appearances, and you're like, okay, my battery's drained. What do I do?
Mine is 5, 4, 3, 2, 1. 5 things I can see, 4 things I can touch, 3 things I can hear, 2 things I can smell, and 1 thing I can taste. Brings me right back to the present.
I love that. That's one thing that I actually use for my daughter, but listeners, please write that down because it's incredibly useful not only for adults but for your kids as well. What is the biggest misconception currently regarding therapy in your opinion?
What we talked about earlier.
Yeah.
Therapy is not for fixing, it's for knowing yourself better and for your own personal growth.
What is a boundary that every mom should set right now, on wherever they are? There's no explanation that's needed.
Well, I can share my personal boundary, which is my phone is on silent during bedtime.
Oh my God, the focus modes on these iPhones have been such a game changer during work, at sleep, whatever time. I have a different, yeah, my friends hate me because my phone goes to voicemail oftentimes because I'm
Do
working
not
and I can't get distracted.
do not disturb is a great feature.
It is
Do not
because we
disturb.
are like becoming
We're always
enslaved to
plugged
our
in.
phones.
We
Yes.
are always plugged in. If I can't carve out 20 minutes to do bedtime, something is going on. Like there's just I mean like there's no emergency. There's no fire every day for those 20 minutes. I mean, so I do not take my phone even in the kids' room when I'm doing bedtime because I know if I see something light up or I get like then that's it. That's like my attention, my mind, my eyes are pulled to it.
Absolutely. And I think there's a small list of careers maybe that you may need your phone on, but 20 minutes is 20 minutes, right?
20
we're not
minutes.
even asking for very much. We're just asking for a
Yeah.
small period of time out of 24 hours.
And if you are in one of those careers, I would highly encourage you to change your notification sound or settings so that you can differentiate
Oh, good
what it
point.
is for. Because if your text sound or your ring sound is the same for socialization purposes and
Mm-hmm.
for emergent situations, then yes, you're going to be drawn to seeing what it is because you're like, oh, I'm in that sort of field. But if you just differentiate the sound or the notification, then you can still make that conscious decision.
I like that. I'm actually going to add that to my husband's list today. Another thing I want to add is you had mentioned being plugged in at all times. We have devices all around us: iPads, computers, laptops, our phones, our Apple watches, or our smart watches. I have an Aura ring. Can we practice maybe or normalize getting rid of some of that? Do we
Yeah.
need 20 ways to communicate and get the exact same information? I think my favorite and the most proud move that I had made was to get rid of my Apple Watch. Like, I
Hmm.
did not need to get pinged every 5 seconds when, Target was having a sale, plus a text
Hmm.
message, plus, a reminder to get up. I mean, talk about thought interruptions and focus interruptions during my day.
Yeah.
And I
It's
took
just
back a little
now
bit of
it's, yeah.
control.
I love that. It's so funny you mentioned the watch because my husband got me an Apple Watch one year for Christmas, and I immediately, it didn't even open the box. I'm like, I don't need another thing to tell me something is going on in this world. Like, I
Yeah.
am so connected that I just do not need this. And I unopen, and he's like, well, you never like any of the gifts I get you. But I'm like, it's not the gift. It is the amount of like burden this will place on my mental health. And I'm going to protect that realm.
Yeah. One, can we just all acknowledge, Dr. Sawhne, you put up a boundary. Two, you acknowledged a love language that you are also requesting, like space and boundaries, and the foresight that you're like, this is already gonna just not be great for me.
Yeah.
So I love
Knowing
that.
him, he'd be like, I'm going to the grocery store. Make sure your watch is on. I'd be like, where are the eggs? Like, what's next on the grocery list? That's all I would see. And not, this is
You don't
not
need
for
that.
me.
You don't need
No.
that. Okay, last question. What is the worst mental health advice you have ever received?
My favorite is just think positive. You'll be fine.
Oh my God. That's like,
Like,
I think
what
it's a,
does that even
is that a
mean?
South Asian thing? I feel like that is the most
Like,
notorious thing that my
like,
parents have ever said to
yeah,
me.
what does that even mean? Like, okay, I'm feeling sad and anxious. I just need to smile harder. Does that work? Yeah, it just seems so dismissive. Like, our real feelings are like the problem of your mindset. It, instead of like the real experiences that you're going through that deserve care and attention. So you can't force happiness. You can't ignore pain. Like, sometimes you do have to sit with those uncomfortable feelings and understand them and work through them. Like, you can't just like put on like a good vibes sticker and just move on. Like, this whole
Yeah.
like just think positive, I think that's so much more isolating for people because it's saying like, if you're struggling, you're not trying hard enough. And that's
Yeah.
the furthest thing from the truth. Like, it's just not helpful.
Absolutely. Like, it's all your fault, which then adds to all the pressures that we're experiencing, which
Right.
probably led us to this feeling in the first place.
It's like what you were saying earlier, right? Like about feeling grateful to have one child, but then not being allowed to have an experience that made you feel unhappy, that was painful for you. I mean, what do you mean just be positive or be grateful? Like, yes, that's true, but why minimize what you're experiencing right now? I mean, that is still a
Absolutely.
very lived, real experience.
Absolutely. Even when I was going through my depressive episodes last year, I still remember someone within my family. Um, I wasn't very open. I know who to turn to for,
You know, your people.
validated opinions. Unfortunately or fortunately, my parents are wonderful people and they're very supportive, and I turn to them for a lot. Mental health help and support is not one of them, and that is okay. There is no blame or shame about that. But there was an instance where it was shared, and it was thrust back upon me. Flora, you're just doing too much. Flora, why can't, and again, this is not from my parents, but it was from a family member. Flora, Sanjay has a good job. you can stay part-time and do all the housework. You don't need to pursue everything else that it's adding extra stress. No wonder you're depressed. And I knew at that point, I'd gone through these experiences before. I knew at that point that that's not obviously the truth and that's not something I'm going to internalize, but it still happens. It
It
still
still
happens
happens. I
if
mean,
you think
culturally,
positive.
that is the default for us
Mhm.
as South Asians. That is the
Mhm.
default. Even as being like a South Asian mom and to have relatability with like women, like older generations. I mean, like this strong, self-sacrificing mother. I mean, that's sacred in our culture. For
It
me to be
is.
like, actually, I just attended a conference over the weekend and I had my husband and the kids go to my in-laws because I wanted to protect that time and space for myself. And I could have done the whole running back and forth between attending
Mhm.
sessions, being back for bedtime, going out for the networking. I could have done that. But I chose, it was a very mindful decision to be like, I am going to be present and give myself for this weekend that I would like to attend to further my career. And so there is a way to manage my other expectations and realities, right? So I don't know if my mother would have ever done that, and I don't know if many other women in my family would have done that. I think people are like that could come across as selfish, and that generation is like, I'm not selfish. My kids are everything, or I, whatever it is. Like they just don't want to be viewed as putting themselves first because
Absolutely.
that's just not ingrained. Like you're not supposed to complain. You're supposed to keep the family together no matter what the cost is, right? Like there's beauty in this like sort of like self-sacrificing mom
Mm.
image, but you're never taught that you're allowed to have needs of your own. Right? Like
Absolutely.
that's not taught to us growing up, but that
Nope.
is something that's very insightful for me now that I have to be mindful about practicing.
Yeah, that's such a good call out. That we may not have had the best examples because it was a different scenario, and different environment at the time. That we do have to make up our own boundaries about what works for us, not what is, maybe bringing your kids and your family to conferences may be helpful to some people. Maybe that brings them a little more peace. I'm like you, Jasmine. I need some space, and it actually is a very welcomed break from the everyday burden of life. Versus, I actually love spending time with my 9-year old who is now becoming, having like all kinds of preteen stuff. And my husband, I actually really do enjoy it. But all the other stuff, like
Yeah.
I'm the planner of the
Yes.
family. I'm the, not that
Yeah.
anyone's asking, I just place
Mental
my hat
load.
on.
Yes.
Correct. And so to be alone on a trip, learning, connecting, and also just debriefing by myself too, like
Yes.
coming back to the hotel room and not ruminating, but just going over the day and thinking and
Yes.
self-reflecting and recharging
Wonderful.
my battery. I mean, oh, that sounds like a dream. So I'm glad you took some time for yourself. And I'm assuming your family still had a wonderful time at the in-laws.
I think they had more fun there
Correct.
than they had all the cousins and they were just running around like crazy. I mean,
Core
it
memories.
served everyone so well. And it's the first time. I mean, I'm 4 months postpartum. So I wouldn't have done this with my first because I did not have that insight at that time. And so now I feel like I'm able to rewrite a lot of what I had to push through because it was normalized to me to push through at that time. So, yeah, I mean, again, the more awareness you have of around your own patterns and you're able to name it, you're able to kind of propel yourself past it. So I think that's really, really important.
Yeah, Jasmine, you have shared so many wonderful gems today. Everything from defining these terms that are thrown around every day: stress versus burnout versus depression versus high functioning depression. We talked about anxiety. We talked about rumination. We talked about tools for both. We talked about where to start for all of us busy moms. Where can we start with habit stacking and building in these tiny, tiny micro breaks and bad ways to cope with stress, good ways to cope with stress. We even got into some cultural talk. I appreciate your time. I appreciate your energy, yet giving a little bit of yourself to us. And I know our listeners are going to benefit from this episode. So thank you so much for being here. Where can our listeners find you?
Website, jasminesawhne.com. Instagram, Jasmine Sawhne MD.
Awesome. We're going to link all of that into the podcast information page. All right, Beyond listeners, that concludes this episode. Thank you so much for being here. And just remember, friends, this podcast is a two-way conversation. We love to hear from you. So please, if something in today's episode resonated, you shout it from the rooftops, share it on social media, DM me, DM Dr. Sawhne. We want to hear from you. And don't forget, the best way to support this podcast is to hit that follow button on your listening platform. Leave a rating, leave a review, share it with your mom, your sister, your partner, your friend, your colleagues, whomever, because like Dr. Jasmine said, the more we talk about it, the more awareness there is, and the more we can learn from each other. Thanks for tuning in. And as always, remember, mindset is medicine. Keep showing up for yourself, and we'll see you next time. Bye. Thank you so much for joining and spending your precious time here with me. As someone who prioritizes her energy, I am so grateful that you chose to spend yours here. To help me help you, please take an extra 30 seconds of your time to rate and review the podcast on your listening platform. For more tips and a behind-the-scenes look into my life, follow me on Instagram at Dr. Flora Sinha. That's Dr. Flora Sinha. Finally, connecting with you truly fills my cup. So DM me on Instagram, email me at florasinhamd@gmail.com, repost if you love this episode. I love hearing from you. I am so grateful for you and cannot wait to be back for the next episode. Bye.